Jody, what else is going on over at the Rappel Diabetes Learning Center?
Well, in addition to our campaign for Diabetes Awareness Month in November and our World Diabetes Day celebration, November the 13th, we have ongoing classes for diabetes education. That includes a lot of different aspects. That is a little more detailed, a little more in-depth than what we'll be having in our program on the 13th. And we do see and have, again, not only the patient but their immediate family. We do allow for that. That will start out with classes, and most oftentimes it will be 3 classes with me, the nurse educator, and 2 classes with Miss Jan, the dietitian, who's also a certified diabetes educator. So they get the best of both worlds there.
Now, are the classes, let's maybe start with step 1. Someone goes to their primary care physician and they are diagnosed with diabetes.
Yes.
No matter what type it is. What's their next step?
Basically, if the physician doesn't suggest, most of them will usually, that the patient come on over to the diabetes center, a person can certainly stop by. We are open to the public. There is no appointment needed to just stop in and ask questions.
9 to 4, Monday through Friday.
Yes, ma'am. And then if a person would like to take the actual classes that we have, that we offer, there's a little bit of a process there for medical purposes, insurance and billing, and it is a doctor referral. And so we would certainly, we can either initiate that from the physician, or the patient can ask for that right at their doctor's office.
I was going to say, let's say somebody moved to town with diabetes. Can they ask their physician for a referral?
Yes, absolutely. And most insurances cover diabetes education, and we do verify that to make sure before, so there's no surprises. And then the other thing is, even if a person has had education in the past, let's say it was several years back, a lot of insurances, if a person is having trouble, if the blood sugars are higher or they're not well controlled, there are some allowances for that as well. So I just encourage anybody that has any kind of issues, if you're seeing higher blood sugars on a regular basis, and that means 2 or more blood sugars above 300 when you're sick, or if you're having repeated high blood sugars either in the morning time, a lot of people test fasting, give us a call, let us know. If your blood sugar levels are reading higher than what your doctor has set for you for your goal, usually a good goal somewhere is in the neighborhood of 70 to 130 in the morning. And if you're not hitting that, you know, on an 80% or more basis, then you really need to let us know, let us see how we can help.
Right.
Because the longer those blood sugars go up, the more they go up. And they continue to, for a lot of people, just slowly climb. And that's the scary part.
Right.
You wake up one day and your blood sugars are through the roof, and then you begin to not feel well because of that.
Yeah.
And that's the scary part of diabetes. It's sneaky.
Yeah.
And so we try to help with that. I know another thing that people struggle with is getting the right supplies, the testing supplies, if a person was on insulin, the insulin supplies and things like that. So we do have some resources there available. And we're more than happy to help at any point with anybody's diabetes.
Right. What a lot of people don't realize is, other than the classes and with the physician referral, that almost everything you do over there is free.
Yes,
and the other community houses are free as well. And we just finished the Lend a Hand campaign, which was the fundraiser for the community houses, so that they can have folks come in, get educated, learn more, have the educational tools, have some handouts, that kind of thing, everything to take with them. So, yeah, it's...
And we have such, we were mentioning earlier, such a community partnership, you know, Baxter Regional providing for the community providing for Baxter Regional. It goes hand in hand there with
certainly does.
Quality health care. And that's, I think that is something that I know personally, and I know you as well, feel like that's something that we strive for. Baxter has got to be and is a step above, and that's where
And
that
we
comes
want-
from.
We want to
Yeah.
keep it there
Yes.
each and every day. We've got some of the most incredible technology that's out there right now.
Sure.
And that's all from the generosity of our community that wants the best. They want the best health care, and we're sure as heck going to provide it for them.
Well, exactly,
So-
and I just completed another round of insulin pump training, and what that means is I'm certified to teach and to educate folks about their insulin pumps. And these are from, there are 5 nationally branded companies. And so a lot of folks don't understand they don't have to drive to Springfield or to Little Rock or to Fayetteville or Jonesboro. We have so much great technology right here, and being able to help folks with that, even if it is just one patient a week that I can help with that, that's saving that one patient. That's
Absolutely.
overcoming another barrier for another person. So it is very important.
Because it's never just the pump.
No.
It's the drive. It's the stress of driving in traffic. Again, if you've not driven, Mountain Home, rush hour, let's see, 5 to 5:45 max.
Right. And the realities are, I think, and I say this often, and I know I preach this to my patients often too, but diabetes is a patient-managed disease. The physicians, the pharmacists, the nurses, anybody else, the dietitian, is there to help that patient manage their diabetes. And it starts with that patient. And so I try to, and I feel like we keep up with big city technology, diabetes-wise. We offer a lot of the same services that the endocrinologist's office do with the pumps and the continuous monitoring, all of the bells and whistles that anybody could ever, need in Mountain Home.
And
so
support groups. And that's real important.
Yes.
I know that when you talk about your kids.
My kids,
Your
yeah.
kids, they're all your kids. That they gain support from each other, as do the adults.
The families, I think, of the children really enjoy getting together and doing things. We do some different support groups with them. This summer's grand adventure was the big float trip that we went on, which was a ton of fun.
Yeah.
And if you've ever, gone out on the rivers and the lakes around here, you know how much fun it is. But taking a whole group of kids with diabetes and their families and their family members, just seeing them interact with each other and have that camaraderie and that support with each other. And then with the adult support group, a little more structured, a little bit more of a lecture style support group, because as adults and with adult learning, we get oftentimes, not only do we get more from a lecture learn, but also in a group setting. And so studies have shown time and time again, if you're there with someone of like-minded issues, then you're going to feel more comfortable asking questions.
Sure.
Yeah. And so we provide the type 1 support group on an ongoing basis, and anybody is certainly welcome to call and find out info on that. And then our type 2 support group meets every month. January through October. We will not have a meeting in November or December because of the holidays, but it's the 4th Tuesday at 5 p.m. and again over in the Lagerborg dining room at the hospital.
Because so many people come. And that's a good time to have it. It's just a really good time to have it.
It is.
It catches folks, can leave work a little early. And
and we have, I always tell people they don't have to listen to me talk. I know they get tired of listening to me. But we have each year we schedule different guest speakers for all of our different classes that we have. And I think people really enjoy learning, understanding more. I mean, we did a self-defense class this year. We've done all kinds of different things to not only build that support system, but also we're looking at, living life, being comfortable with our diabetes, understanding that it does not have to limit or have limitations on the person's day to day.
It doesn't have to control you. You control it.
Yes.
Yeah. And that's a huge concept for many people. I think when they're first diagnosed that they, oh my goodness, I will be controlled by. No. Here's the resource right here.
We
go
do.
to.
We
Yeah,
try to
help.
provide those, not only the physical resources, but like you said, the mental, the support, and,
Yes.
and that
Yeah.
is a huge barrier for a lot of people. So I think it's just a wonderful opportunity for a lot of people. And like I said, even if somebody is not newly diagnosed, staying current, staying
Yes.
up to date.
Yeah.
I'm putting together the program for the 13th of November, and one of the big aspects that we're going to concentrate on is all the new medications that are out. Because you see on the television, you get those
Just bombarded.
commercials,
Just bombarded with them.
and it
Yeah.
is unbelievable.
Yeah, people need to get the real facts.
And I always like to say, and I pull up my name tag and say, I'm your nurse. I'm not a salesperson. I'm not
Yes.
trying to make money for anyone. I'm
Right.
trying to take care of you.
Yep.
And I hope people take that to heart and know that and understand that they can certainly, if there are questions, if you get on a new medication, I have people call and say, well, I came to your class about 3 years ago, and then they go into what's going on with them now. And that's certainly fine. That is totally appropriate to utilize resources time and time again. And I
Right.
think that's what's so great. I know we are very blessed to be under the foundation at the hospital, but that's what's so great about the foundation is they provide continual services. And I know Barney always says to us, we're going to make sure that we take care of every
Yep.
time. And that's
Absolutely. Every patient, every time.
That's what it's all
Yeah,
about.
it
And
is.
with chronic disease, you can't get away from it. We're not going to cure you of diabetes, unfortunately. Right now, there is no cure for diabetes. But management and self-control
Gonna
of the
help you
diabetes.
live, in quotes.
Yes.
With diabetes.
Sure,
Yeah.
sure.
One more time, Jody, we're running out of time today. It's going to be on Friday the 13th
Yes.
for World Diabetes Day. It's going to be a breakfast starting at 7 a.m.
Yes,
and
ma'am.
we're going to run till noon with after the breakfast. That runs from 7 to 8.
8:30.
Yeah,
Mhm.
someplace
Yes,
in
ma'am.
there. And then you're going to go into your program, and you've got vendors that are coming,
Yes.
and prizes and fun, and a theme that we don't know.
A secret theme, yes.
Secret theme. And can you give us the phone number again?
Yes, it's 508-1765. That rings directly into our office. And like I said, even if it's on a weekend, give us a call, give us your name and number, and we'll get you on the list for registration. Call you back and let you know that you are confirmed. And we just want to make sure that everybody is able to come out and celebrate World Diabetes Day.
All right. I will see you there. Will you come back and see us again real soon?
Yes, ma'am. Thank you.
Thanks for joining us today. And thank you for joining us today for BRMC's Healthy Connections.